primary care is an innovative, alternative path to insurance-driven healthcare. Typically, a patient pays their doctor a low monthly membership and, in return, builds a lasting relationship with their doctor and has their doctor available at their fingertips. Welcome to the My DPC Story podcast, where each week you will hear the ever-so-relatable stories shared by physicians who have chosen to practice medicine in their individual communities through the direct primary care model. I'm your host, Maryal Concepcion, family physician, DPC owner, and former fee-for-service doctor. I hope you enjoy today's episode and come away feeling inspired about the future of patient care, direct primary care. Thank you so much, everyone joining. I'm Maryal Concepcion, family physician and DPC owner in rural Northern California, and I host the podcast My DPC Story. And I was so excited to bring the conversation with both Camila Guerrero, who is joining us today, as well as Ashton Casper, who's not on the call today, but was on the podcast talking about the importance of Zion HealthShare in this moment of our country where people are really scrambling for access like we've not seen in a very long time. And so today we have both Camila Guerrero, who is the practice manager at Brock Family Care in North Carolina, as well as Preston Guthrie, who is the head of sales at Zion HealthShare. And it's a fantastic follow-up. I am so glad you guys are with us today because we've had so many people send messages directly to me like, hey, I can't make it to the meeting, but can you ask them this? Can you ask them that? People are so interested in how to interact with Zion, how to sign up for Zion, how to express what Zion HealthShare is doing for both patients and DPC physicians and physicians who are thinking about doing DPC. So thank you so much for joining us today.
That's great. Thank you.
Happy to be here. Thanks for having us.
I think it's so intentional that you guys are just following up on what Ashton said in the episode where, when you call Zion, you actually get a person. And so I love that you guys are being intentional about taking this time, following up after the podcast, and being there for people who have questions right after they've heard about the little top of the iceberg as to what Zion HealthShare is bringing. Preston, could you share a little bit about your journey into being part of Zion HealthShare, and what is the top thing that you keep getting asked about Zion HealthShare, especially in this moment in time?
Yeah, so I got started in the insurance industry a little over a decade ago. I started out as a broker, then I was in like the health benefits tech space for a little while with some startups, and then most recently with a level-funded health insurance carrier that was based out of Texas. And my entire career has always been based on, man, the system just doesn't work the way that it should. And when Ashton approached me about, hey, we want to revamp our sales team and our sales program, and would you be willing to come on board? And I was skeptical, right? I mean, being ingrained in the insurance world for so long, when somebody says health share, I'm like, whoa, that's scary stuff. There's no guarantees behind it. And then I thought about how many guarantees are in the insurance world, and it's, well, there's not. So I dove into it, and I was just fascinated with the community, with the program. I jumped into the reviews on everything that was going on, and all I could find were just really, really happy people that when they did their homework and they researched what they were coming into, it was something that it turned into a no-brainer for me. And I thought, what if I feel that strongly about, man, the system's broken, there's no better place to be doing that than here at Zion HealthShare. And so that's what made me come on board. And you're right, we have a culture of community, and that is what I love. We've got account managers that are on our team, and I will walk by their desks and walk into their office, and just they are on the phone trying to help people solve problems, trying to get them to feel good about whatever's going on, whether it's a business owner that just feels, man, doesn't work, I can't figure it out, or hey, we had our premiums go up by 28%, we don't know what to do, we can't afford this right now, or just a family that's, I can't do this, I can't afford this, I don't feel like I get any value out of it. And that's what we're here to help people do and understand. With everything going on in the insurance space right now, especially like with open enrollment and how subsidies changed, and a lot of people are just kind of stuck without anything to do. We had a major influx of phone calls and people just trying to reach out to just understand a little bit better. Hey, is this a viable option? Is this something that we can trust our families' situations with? And we want people to know that this is a situation that is here to help people. We're always looking for ways to make sure that people's health situations are taken care of. And there's so many different ways that we work with them and so many different options that we want to make sure that families are taken care of and they feel good about it at the same time.
This is fantastic to have you, who's on the team, who's seeing these outcomes in mass from the people that you work with. But also we have Camila Guerrero, who is a Zion HealthShare member herself, as well as she's been talking with patients who have benefited from using Zion HealthShare. So with that, I definitely want to open the floor up to questions. I know we have people who are on the physician side of healthcare. We are here to take questions. So I got so many questions about, I heard Ashton and Camila talk about pre-existing conditions, but I still am concerned about pre-existing conditions. So that was the one I got probably 4 or 5 questions about. So if you guys could touch on pre-existing conditions when a person signs up for Zion HealthShare.
Patients don't have to disclose any pre-existing conditions when they're signing up, because that's not even a question when they're enrolling. But they do need to know if what Zion considers pre-existing conditions, which they actually call pre-membership conditions, is if you have been treated or you've had symptoms that have been treated or taking medications or being seen by a provider in the immediate 24 months prior to signing up for Zion, they consider that pre-membership conditions. So basically, if you had something happen to you 5 years ago, 10 years ago, and you haven't had anything since, they don't consider that a pre-existing condition. And if for some reason that reoccurs while you are already on Zion, then of course they're going to review medical records, but the guidelines does not consider that pre-existing. But if you've had something that they, after reviewing your medical records, qualified that as a pre-membership condition, then you have a 1-year waiting period where they will not cover anything related to that condition specifically. And then the second year, they cap it at $25,000 for that specific condition. And then it goes to $50,000 the third year. And then after that, $125,000. But that's only for that specific condition. Everything else, there is not a cap.
Just add to that too. This doesn't make me a very good salesperson, but there are some situations where, hey, for some people, they might come in and our sales team gets this question all the time. Hey, I got this situation. I have this going on. My family has this. My wife has this. My kids have this. And a lot of times we are happy to run through those situations with you and kind of walk you through it. I mean, we're going to give the same answer that Camila did of, hey, here's our pre-memberships. It's posted in our member guidelines so people can go through and understand exactly what that looks like. But on the flip side to it is sometimes a health share may not be for everyone. And so in those situations, that's when insurance is a good fit. I mean, we don't want to ever turn anybody away, but for those situations, it's like, hey, so that's why insurance exists. That's why the ACA, that's why the pre-existing conditions was put into place. So, but like Camila said, hey, if you want to join our health share program, fantastic. Everything else is still going to fall under the guidelines. And so it's just that one specific thing, that pre-membership thing that falls under those caps and the waiting periods. So, but once again, feel free to call us, chat with one of our sales reps, and they'll be able to hold your hand and walk you through that specific situation for you and your family.
It's almost like a meet and greet like we do in DPC. So that's a good
That's right.
Yeah. So a question from the audience, is Zion HealthShare membership open to people of all faiths?
That is one thing that we take a lot of pride in, is that we do not discriminate based on faith or on lifestyle. We are a faith-based community, but we don't ask any faith or religious specific questions upon joining. And so, no, there are no requirements, but we are a group that believes in a higher power.
There is no statement that they require you to say that you're associated with any religious affiliation.
Another question that I got after you guys were on the podcast is, if you are a person who is wanting to be a direct primary care member and you are a Zion HealthShare member, how do you then approach a DPC saying, I have Zion HealthShare, but I want to be a DPC member? Because that's actually happened with a couple of people who are listeners in their clinics, and they didn't know, they didn't really know how to optimize their answer. And so I'm wondering if you can help them optimize their answer going forward.
I would probably then involve Zion on that. So to see if they can switch the person's membership from direct membership to essential membership, since there is a difference there. Essential membership really is the one that pairs with DPCs or employers. So there is a difference in price, and basically essential membership it's a supplement of DPC, because like I said in the podcast, DPC pretty much covers 95% of what the patient needs, and certain items that is included in that direct membership that the cost of the monthly cost is a little higher, includes certain things that you don't need because the DPC already does. The telehealth, and many times even the mental health, preventive, like in the sense of an annual physical and things like that. So there are certain things that's not needed. So you can add it. You can pick and choose what you want on the essential membership, where the direct membership you can't. So that's where we can talk to Zion and basically look them in and say, okay, I have a new patient that's our member now and already has Zion, but they would like to switch from direct to essential membership, and then they'll make the switch.
The other thing that I'll add to that is if you are a DPC doc and you aren't already partnered with us, reach out, right? Our team will happily help train you. We had a DPC doc in our office a few weeks ago, and he's fairly new to the DPC world. And at lunch, he was like, Preston, I love Zion HealthShare. Like my family uses it. Like I had a kid that was in the hospital and we love it, but I don't know how to incorporate that into my practice. And I kind of took a step back and thought about it. And I thought, man, when I go to my doctor, I don't feel like my doctor, like he's engaging with me. He's talking about me. He's talking about all the things that I have going on in my life and my health and all this stuff, right? And he's not trying to sell me anything. And so I really kind of took a step back and I thought about that. And I was like, oh, you know what? My team is going to do a few things a little bit different on like how we can help train doctors, how we can help train their team to be able to like, hey, here's how to present it, right? And Camila and I had a really great conversation a few weeks ago on how she helps the patients in her practice. And we want doctors to feel like, hey, you focus on your patients and you focus on what their needs are. Let us do the heavy lifting. Let us do the training. Let us train your staff. We'll send you a box full of things to be able to put in your office or to present to people that, because there are people that will ask, and there's other people that want to be able to just know that there's another option out there. So if you are a DPC doc that has been with us in the past, or you are interested in it, let us train your team. And please don't ever hesitate to call us and say, I just want to know a little bit more. I just want to feel a little bit more confident talking about it. So that way you don't ever have those second guessing situations when you do have a patient that's in with you that's asking those questions.
This question came from somebody who is in the Washington, D.C. area. So what do you guys say to people who are practicing in states or areas of the country where health insurance is required within that state? Because Zion HealthShare is not health insurance, it is healthcare access.
That's a tough one. There are options out there that are available. There are different companies and TPAs that can put something in place that you can go purchase, like what they call like a MEC plan, or minimum essential coverage, which essentially comes in and says, hey, these things are what you need to say that you have an ACA compliant plan. And so if you have a broker or a TPA that you know of that can say, hey, we can sell you one of these plans, whether it's a individual or family, or it's a company, or through your DPC practice, there are solutions that, and if you reach out to us, we can point you in a few different directions. We don't do that in our company, but it's a direction that we can point people to. So that way they are meeting those requirements of the ACA. So that way they don't have the penalty, but then they'll be able to still utilize a health sharing program and their DPC at the same time.
And a follow-up question to that, on your guys' website, you have healthcare advocates as part of Zion HealthShare. In terms of how are they positioned differently than people who are helping members apply for Zion HealthShare? Because would they be able to help out somebody who's wondering, are they meeting the requirements of their state or not? Could an advocate at Zion HealthShare help them also navigate that decision?
We have to be careful when we get into that realm because there are laws around talking about insurance, right? We are not insurance. We are not licensed to discuss their insurance requirements. And so we don't want to come in and say, oh, hey, here's what you guys need. Here's the checklist of things that you need. We can give an overall suggestion on what you need to be doing to be compliant, but we can't give any suggestions, right? Because that's freaking insurance law. So we're not insurance. We can't sell you anything. We can't suggest anything, but we can lightly say, hey, here's some of the things that you're going to be needing if you want to be compliant in that area. But then also, we have a lot of really good relationships. And so if you say, hey, I don't even know where to start, we can point you in directions of companies that would be able to help you out and sell those products as well. But that would not be us.
In the Zion's website, there's a pretty good summary per state of what each state pretty much requires. And then I think it has a link for each state law that has some type of restriction on insurance. So you can check that out.
Super helpful. ZionHealthShare.org if you're looking for that website, and we'll put it in the video here as well. When it comes to partnerships, you definitely have resources that are open to anybody, including Zion HealthShare members, as well as the general public. But you have, if you're looking for help with labs, if you're looking for help with colonoscopy access, you have partners listed. When a person is a member of Zion HealthShare, if they call in to say, hey, I would like to go to the place that is direct pay friendly, or somebody is coming to you for a recommendation on who to actually see for a type of procedure, do you guys talk about that with members of Zion HealthShare?
Yes. In so many words, yes. We actually have a few different tools for them. So they can call and they can talk to one of our member advocates that are going to be able to point them in different directions. We actually have a map inside the member portal, so you have to be a member to see this, that shows self-pay friendly doctors that we know of, right? Not even necessarily doctors that we partnered with, but maybe doctors that we have worked with as we've had members come in and utilize them, and there's been positive experiences. So we're not even suggesting like, hey, these are the doctors, but that is an option. We also have a DPC mapper on our site, so that way you can go in and see DPCs that are in your specific area. But yeah, we definitely will point people in directions of, hey, we know that this surgical facility, we've had a really good experience with this surgical facility or this oncology center and things like that. And once again, we don't have a network. We're not insurance, so we don't require that anybody goes to any specific place, but they call us and ask us, we're going to say, hey, yeah, we've had good experiences, or we've had members that have had good experiences in XYZ facilities.
Also, when you open a sharing request, of course, you're assigned a specific processor that's dedicated to your specific request. So pretty much they are your point of contact. So any questions that patients have, they can ask that specific processor. And if for some reason they don't know the answer, they'll try to find it for you. But really, in a DPC side, since most of us here, that's our world, I try to help the patients find those, because we know more our area, where Zion may not know your specific area to know where to go. So yes, they can point you, but if you have that direct relationship with the DPC, that's probably the best route.
I got a couple questions about obstetrics and maternity care. So Camila, this is definitely following your journey and sharing your story on the podcast. But one question I got from a listener was, what happens if you find out that you're pregnant and you have done workup like labs or ultrasound before you submit a claim? Will all of the care that is related to that pregnancy be covered under one shareable event, or how do you guys handle that?
That if you become pregnant before you have Zion, they would not cover anything on that maternity, because actually you have a waiting period. In the beginning, when I joined, I believe it was 60 days, but now I think it's 6 months. You have to, it's very specific in the guidelines. You have to wait. If you're planning to become pregnant, you need to wait at least 6 months after you join in order for Zion to cover that maternity.
And another question that came in the realm of obstetrics was about patient access and what happens if a patient is needing care but they live in a restrictive state. So, for example, if somebody is having a miscarriage, but they are a Zion HealthShare member from the state of Alabama, and you are visiting family in Washington, and you happen to start bleeding out of nowhere, and you're in your second trimester of pregnancy, what happens because a person is not necessarily able to go back to Alabama and get care? What would happen if they were in a state like Washington or California?
They can go anywhere.
Yeah. So yes, because we can't operate families that live within the state of Washington. So that is the unfortunate portion. But if somebody is like visiting family and they're in Spokane and they have a miscarriage or any kind of medical event that would fall under our guidelines, then yes, it would still be paid into.
Another question I got was about the old wives' tales or the common urban myths about, oh, I'm still so skeptical because this health share that's not Zion HealthShare didn't cover anything and I still had to pay. So I got questions about it doesn't actually work was basically the gist of this question that I got. So how do you guys talk to people who are coming to you with skepticism?
I usually give examples. I have a list of examples in front of me here. I said some in the podcast, but basically, like, I had a patient that started having some symptoms and ended up finding their lung. It was in December, and through several tests through January, they were diagnosed with stage 4 cancer. And so, anyhow, Zion has been wonderful with this. They pay their IUA, and working with the hospital too. We try to help sometimes. We try to help Zion sometimes too, like with getting financial assistance and things like that through hospital systems. But anything that's not covered through the financial assistance programs, we send to Zion and Zion pays. It's been no problem. It has really alleviated a lot of the burden off the patient because that diagnosis is already a huge burden, and they don't need another burden with the thinking about how are they going to pay for this. So another thing is I had another patient that were diagnosed with a very rare kidney disease and require extensive and very costly treatment. Zion's been wonderful with that. I had even a patient that was injured with playing sports, and it resulted in multiple broken teeth, and the dental work was approximately $20,000, and Zion covered that, pay for that. I've had several patients that have had surgeries such as gallbladder removals, tonsillectomy, knee replacement, all of that. I've had several patients that were on the GLP-1 medications. Zion has a certain guideline for that. But basically, if it's FDA approved or if it's through a DPC, a provider orders the compounded version that's approved and all that, you're responsible for your IUA, and then Zion gives up to $3,000 to cover that. I've had several cases from chiropractic care to maternity services, which the maternity I went through it myself, so I know how wonderful it was. And then most recently, I had a patient that passed away from cancer. They did not have any life insurance, and Zion has a end of life benefit, and their spouse were able to get $10,000 check from Zion that really helped cover the funeral and a few other things. So I have not had any bad experience with Zion. The only probably one or two things that I know of patients that Zion turned away was in their guidelines. And I told them, this is the guidelines. It was found in your medical records. This is a pre-membership condition. And it's very clearly stated. And actually, Zion lets you appeal too. If you feel like something they saw it wrong, they let you appeal. It goes to a department that they review that. They even have another department called additional giving that sometimes they talk and basically feel okay, even though it's not in our guidelines, but we're able to cover. So they're very flexible. And if you read the guidelines and you're within the guidelines, there is no error. It's going to be paid for. And it's usually paid very fast.
I've also sat in some of those appeals meetings. And like I was saying earlier, we're looking for opportunities to share more. So it very much is a community of giving. And then going back to your original question, we have an entire team that is specific to maternity care. And that's all they do. That's all the sharing requests they work with. And so if people are concerned, a lot of young families, they are purchasing a HealthShare program specifically because they're like, well, we're fairly healthy and we're going to be having kids and we want to make sure that like we're taken care of. Mm-hmm. And so I think for a lot of young families, the only reason why they would be purchasing a HealthShare or Zion HealthShare specifically is so that way they don't have to take on the entire financial burden of going to have a baby, right? And so we want people to know that, hey, we understand that. Like Camila said, there is a waiting period, right? And it's 6 months from the time you started until conception, right? So don't reach out. You found out you're pregnant. We're going to sign up for Zion HealthShare, and then you're going to be really bummed when it's, oh man. Yeah. So but other than that, like we have a maternity page. You can go read through our guidelines, dive into those things, call us, ask questions. We want you to feel comfortable. I mean, it's a scary thing. I've got a set of twins, and when you're going through that as like young parents, you're just like, man, I hope somebody has my back. And that's what we want to do here. So we want people to feel like, hey, we've got your back. We know that like a maternity thing is sometimes it can be super stressful. Sometimes it's not. It usually is though. So we want people to feel good about it.
And having one child or 10 children, it's the same price. So it's the same membership price. And another thing I wanted to say about the maternity is I know because I have a sister and other friends that have gone through the maternity process through regular insurance. And I know how much they pay a month for their insurance and how much they had to pay out of pocket after they had their baby. And when I tell them how much I had to pay through Zion, they can't believe it. And sometimes some of them actually, it's like almost a year later, they're still getting bills from their insurance. They don't really know how much they're really going to end up paying. So it is a totally different, like I said in the podcast, within 2 months, probably because you're going on the self-pay route. Of course, you get bills from the hospital and stuff much faster because it doesn't have to go through the claim process. So Zion, I think I had everything paid, my hospital bills, everything paid within probably less than 2 months after I had my son. So it's a very smooth process.
Perfect. And Camila, can you go back to the GLP-1? Because I know there's a lot of talk about GLP-1s these days. When you're talking about if a DPC physician or provider is prescribing a GLP-1, even if it's compounded, how does that process work? Because many people will try to do, if they have insurance, in addition to Zion HealthShare, they'll try with their insurance coverage first. But then if it's not covered or it's astronomical amounts of money, expensive. How does that look like in terms of that? You mentioned the up to $3,000 in coverage.
So basically, for weight loss medications, they consider that, of course, a pre-membership condition. So basically, in the first year, they won't cover anything for that. So you have a 1-year waiting period. But then after that, if you meet your IUA, you either pay Zion for it, or you can pay your provider, or you have to show receipts that you paid for that. And all the receipts has to be within 6 months. You have to meet the IUA within 6 months. So after you meet that, then let's say if it's a DPC provider that offers compounded medication like we do, we just provide an itemized receipt to the patient, and the patient submits that to Zion. Then Zion usually issues a virtual card, and then we're able to order. So that's how it's been done. It's a very simple process.
Next question is, how would you advise physicians who are already working and partnered with Zion HealthShare to help optimize, like Camila just mentioned, giving itemized receipts, but are there other ways that DPC physicians and providers can help their patients basically in the Zion HealthShare process of submitting receipts or any other paperwork?
Not every DPC practice is going to have dedicated people, or they will have enough staff to do that. So of course, it's going to depend on each DPC. Ashton said in the podcast, some DPCs that can't do that, just make sure you direct to Zion. Zion can help the members. But in my case, if patients have a need and they don't know how to submit their own request, they don't know whatever, they actually sign a PHI form with Zion, and they give me access to their portal, and I do it for them. So we're here to help them. And I really encourage them to have Zion if that's the right fit for them. So I want to help them as much as I can. And if it's a burden to them, it's a hindrance to be able to, some of them are not tech savvy at all. They don't know how to handle all that. That's too much. Insurance, in one sense, you just hand your insurance card to the provider and they bill for it. Well, of course, with Zion, it's you have to put a little more work into it. For some people, they just think it's too much. So I just help them.
I think the only other thing that I would throw in there is, if that's not something, if you're not in a position to where you can do the hand-holding for your patients in a situation like that, is tell your patients to fall in love with their member advocate, right? That's what we want people to do, is you have somebody that's assigned to you as a member specifically. And so get to know that person. Like they're going to be the ones that like go through everything with you. They're going to be the ones that are coming back saying, hey, we're going to need this. We're going to need this. But then outside of the DPC, if you end up at a specialist or you end up at a hospital or facility or something like that, don't be afraid to say, hey, I need this itemized. I need the super bill. I need itemized information, and they'll get it to you. So don't be afraid. Also, don't be afraid to call us and ask for help. So I feel like that's a common theme that I keep saying, call us.
And it's not like I'm trying to sell Zion, because that's not, I have a lot other things that I do here. So it's not, but it just comes naturally in a conversation. Like if somebody needs it, or even it becomes like, even from a provider standpoint, like if they're talking to a patient and she finds out the patient doesn't have insurance, or even it comes in a conversation, the front desk, or however, it comes in conversations many times. And that's where I talk about their specific needs. And some of them I do say, Zion is not for you. And some of them I say, I think Zion is a great fit for you. So it just depends on the specific need. And I'm very honest beforehand, because I don't want people to sign up for Zion and then they're disappointed. So it just depends on each person's needs.
If a patient of a DPC and Zion HealthShare is needing to get a knee replacement, the question is about pre-authorization. Is there any scenario where a person would be better off trying to get a pre-authorized knee replacement through their insurance versus through Zion HealthShare if they did not have a pre-existing condition and were both a DPC patient and Zion HealthShare member?
If they have insurance and Zion, Zion requires them to file their insurance first. And then whatever their insurance does not cover, that's when you would still be responsible for your IUA, and then Zion would pay the remainder, the difference. But if you have insurance, it is in their guidelines. You have to disclose you have insurance, and you've got to file that first. And really, that has come up with patients asking me, like, Camila, I don't have any, they're young, I don't have any needs. I mean, I'll probably become pregnant sometime soon. What do you feel like? Do I need just to get insurance? They had already Zion. Do I need to get insurance because they're offering for me for free, in a sense, through work? I don't have to pay anything monthly. And I told them very specifically, I said, if I were you, I would not, because it's so easy and very, very straightforward process with Zion. If you have insurance, you're going to have to go through the insurance route, and they sometimes, especially with maternity, sometimes hospital systems that they do not file anything with insurance until the end of the process, and you have to wait until all the claims are processed. It will be more of a headache. So there are certain things like that, but there are other people that I say you need to have insurance for your pre-existing conditions until you at least reach year 2, year 3 with Zion. Then you can drop it. So it's a conversation that it's very specific to each patient.
I was just going to add on, not really add on to it, but if you have insurance is primary, and Zion HealthShare is secondary. That's really what it comes down to. So we don't want to turn anybody away. If you have it,
right.
If you have insurance, we don't want to say, hey, no, don't use us. But a lot of what we do and how we work with the system is we get a lot of self-pay discount. There's a lot of all these things that we utilize. And as soon as you show up and you show your ID card for your insurance company, like a lot of those discounts just immediately go out the window. So.
And sometimes, like I said, the reason why I would tell certain people to keep their insurance at first, and many times I tell them, just get a high deductible insurance just in case something happens to you with a specific pre-existing condition. But in anything else, you would be cheaper, because even if you go through your high deductible and let's say you fall and break your arm, then you don't have $7,000 to pay. Let's say your IUA is $1,250, whatever your insurance doesn't pay, then you're just responsible for your $1,250, and then Zion would pay the rest. So it's more to cover them for their pre-existing, but in no other scenario, I would say keep your insurance. It's just more as a placeholder until the person reaches a certain membership year when they're with Zion.
This is a fun question I got. When it comes to, there's applications that you start an application and you don't realize it's going to take you 45 minutes and you need 7 pieces of documentation to fill out the application. If somebody is wanting to become a Zion HealthShare member, what do they need before starting the application process?
Their form of payment, and that's it.
I was like, they need to know their personal information and what their card number is. So yeah, that's it. Great answer, Camila.
Very simple. Very simple. It's nothing like going to the marketplace website.
The other thing is you don't need your kids' social security numbers, right? I have 4 kids, and I feel like anytime I go to apply for something and then they're like, you need your kids' social security numbers, I'm texting my wife and I'm like, go find them. I don't remember where we put them last time. So yeah, we don't need social security numbers.
Wrapping us up, I'm wondering if you could just mention some big misconceptions about Zion HealthShare that we have not covered yet that you really want the audience here and the audience listening in general to understand.
I think that just health shares in general kind of have that rap of, yeah, but when things get bad, who has your back? Because it's not governed by the ACA and there's no regulations around it. We are a community of like-minded people that are here to support one another. And so we want people to feel like, hey, if you join Zion HealthShare, we are here to help support people. And we're a nonprofit for a reason. We don't want to take all this overhead. We don't want to do all these things we want to grow. We want to grow the community, but this is very much a community of people that want to help each other out. And so that's the main thing, right? We are here for each other. We love working with all different demographics. We love working with all different kinds of people. We talked about this earlier, but we don't have the religious requirements. A lot of people instantly think, oh, HealthShare, that means that it's a religious thing, and I am this religion or not a religion at all, and I'm not going to qualify for it. And so, no, like we are here to help everyone. And so, yeah, once again, I sound like a broken record. Call us. If you have questions, if you have concerns, go to our website. Our team has done such a good job of being able to answer a lot of the questions that people are going to have. But the important thing is we are here for the community. And in every decision that we make as like at an executive level here at Zion HealthShare is how is this going to affect the community? And it's what we think about in every single meeting that we have.
And I have two other things that I think we have not covered. One of them is if for some reason, let's say you're out of the country and you have an emergency, actually, Zion would cover that too. Not for pre-scheduled things, but if it's an emergency and you're out of the country, you just have to submit documentation and it will follow those guidelines. You pay your IUA. I've had actually experience with a patient like that too. It was overseas, had a gallbladder attack, and ended up having to have emergency gallbladder surgery, and Zion paid for it. So there are so many examples. And then also, Zion is, when they talk about, like, I'm responsible for my IUA for every single thing I have. Okay. But it's not indefinitely like that. You're responsible for the first 3 for your family. So in other words, Zion, it's me, my husband, and my 2-year-old son. I'm responsible for the first 3. If something happens to me, something else happens to my husband, something else happens to my son, and then something else happens to my son again, or whatever, I'm responsible for the first 3. The 4th one, as long as it's above $500, Zion actually waives the IUA and covers it 100%. I had that situation with a patient too. It was between her and her husband, and they, bless their hearts, they had many situations happen last year, and the 4th one was 100% paid for, shared into. So there are so many things like that, but that's one thing I have to explain sometimes to patients because they get a little, okay, so I'm responsible for what if 5 things happen to me? But it's not like that. And it's not per person, it's per membership. So if you have 5 people in your membership, you're responsible for the first 3. It doesn't matter.
We also call that a really rough year for a family. So.
Yes. Yes, exactly. It's very rare. Very rare.
Yeah, I agree with Preston. I'm sitting here. I'm like, I hope that never happens, knock on wood, especially that your son has 2 things happen to him. So absolutely.
I know. Also, for health shares, many times, because I know another health share that did very well for a long time and then financially started struggling. But so people understand, Zion's very financially stable. So if for some reason I think he ever got to a place where they were not, then they would probably say so. But it is not an issue in the sense of like going bankrupt, like some of them have, and they could not pay anybody's bills. So it's not the situation. So I feel like people can rest assured that it's okay.
Thank you guys so much, Preston and Camila, for joining us today. And thank you so much, everyone in the audience, for joining. I think that this is something that is an evergreen type of webinar. You're always going to have patients who are always going to be fearful about healthcare access. So if you found this webinar helpful, please share it with somebody who you know could benefit from hearing it. Another DPC doctor, another DPC provider, another DPC patient, another future DPC patient, or your neighbor. So please take this recording, share it to anybody who you know who could benefit from Zion, which is basically anybody who values healthcare access. So definitely zionhealthshare.org is where you want to go to read all the nitty-gritty details about what Preston and Camila are talking about. But absolutely feel free to contact us at the contact page at mydpcstory.com, and we'll get your questions answered by Zion HealthShare because they're contactable. Thank you so much for joining us today. Whether you're a patient searching for a real healthcare alternative, a DPC physician looking for a better option for your people, or a practice manager trying to make sense of it all, we hope this conversation gave you the clarity you are looking for. A huge thank you to Preston Guthrie and Camila Guerrero for showing up, answering the hard questions, and reminding us that healthcare does not have to feel like a fight. This is what community looks like. If this webinar helped you, share it. Send it to your patients, your colleagues, your neighbors. The people who need this information most are the ones who have not found it yet. To learn more or to get started, visit zionhealthshare.org. And if you have questions, call them. They actually pick up.